And welcome into To Your Health. You know, as some of my friends come to visit me, they talk about things that are happening to them from an orthopedic standpoint. Number one on the list is normally a rotator cuff or something to do with their shoulder. So to address that today, we have Dr. Lee Murphy, Houston Clinic.
Yes, sir.
And you were here about a year ago, just about.
That's right. I enjoyed it. Wanted to come back.
Yeah, amen. And we brought you back.
Yes, sir.
Because you really gives us some good information. And of course, the shoulder, rotator cuff, what causes that to happen as we're aging?
Yeah, so
or even as a younger person.
Right. It is a common problem, I would say. I mean, in terms of musculoskeletal problems, it is on the upper part of the list of commonality. And it's also something that's my subspecialty. If you ask me, then what's the most common thing I treat, it would probably be rotator cuff problems. The rotator cuff is a commonly disordered problem in our body, I guess you could say, in the sense that by the age of 80, 50% of people have a rotator cuff tear, at least in demographic studies. And not everyone has pain from that. That's an important thing to know. So, you know, this is why it's important to speak to a provider like me that, you know, when you're told you have a rotator cuff tear, it may or may not be relevant to what's giving you trouble. But it is a tremendous cause of disability in our country. It causes pain. I tell people the rotator cuff is a really mean actor because it causes night pain. Oftentimes keeps you awake at night. You can't really quite escape it by, you know, putting your feet up or putting ice on it. Sometimes you just can't run. It's like a toothache, and it really, I tell people it's good for me. It keeps me in business because it is a notorious pain generator, and it keeps me always having to work, is what I'm saying.
And is this one of those things where if you catch it early, it's better than to let it progress?
Yeah, so I think shoulder pain in general ascribes to that sort of mentality because a lot of times what happens just subconsciously when your shoulder hurts is you just stop using your shoulder, which can really give you a second problem, which is a frozen shoulder. So I think it's always smart to just come and get it assessed because number one, it might not be your shoulder, it might be your neck. Number two, we don't want to go too far down a pathway of spending healthcare dollars and imaging on the wrong things. So seeing somebody who I think is a qualified person right out the gate can save money, save time, and maybe get your problem resolved in the least invasive way.
And basically what we should do is to try to maintain, because of exercise, maintain this, right?
Your shoulder, you don't think about your shoulder much until it doesn't work well. And then it's all you can think about because the shoulder is sort of the platform upon which you use your hand. And when you can't put your hand in the correct position in space, you notice all kind of other troubles. Like a lot of people will notice downstream problems with their hand and wrist because they can't get their shoulder in the correct position to brush their hair, brush their teeth. You know, so it's not just about throwing baseballs, it's about living life. And so, yeah, I mean, you know, having the shoulder addressed when it starts to hurt you in a pretty expeditious way is important because a lot of times it becomes a cycle where you hurt so you don't use it, it gets weak. It gets weak, that contributes to continued pain and difficulty. So just coming in to get it looked at and make sure we understand what's going on is a good idea. And to your point, exercising your shoulders so that maybe you can prevent problems as you get down the road is an important thing to do as well.
And when you come in because of the fact you have some kind of a pain, it can normally be treated without surgery early on again.
So many times. I mean, the amount of people we operate on versus treat non-operatively in the shoulder clinic is, I mean, it's so many more patients leave my office with an injection or physical therapy than do with a recommendation for surgery. So it's important to know that. And I'm a big believer in options, that it's your shoulder and that you should be given the choice as to what to do. And luckily I don't deal in something as scary as heart disease or cancer. It's more about how much pain you're having and dysfunction. So we can have a conversation about how far you want to go, and a lot of times there's multiple options as to what we can do, even if you do have a tear in the rotator cuff.
And to keep healthy from a heart standpoint, you have to have mobility. To have mobility,
you got to have your shoulders.
Yeah, the shoulder.
Yeah, no doubt.
The old, this is connected, everything is interconnected.
Correct, and mobility is super important. And a lot of people think about their lower extremities and walking, but your upper extremities are super, like I said, we don't think about it until it's gone. But being strong in your upper shoulder girdle is important for your posture. It helps your neck pain. It prevents neck pain. It also, you know, like I said, you just go around your house and think about how many times you reach overhead to get something out of a cabinet or play with your grandkids or whatever that is. And everybody's got a different, lifestyle. But I do think strengthening your shoulders, being attuned to strengthening your shoulders is important, at least as much as strengthening your core and your legs.
And that's usually an upper body exercise, right?
Yes, sir. I really tell
Like
people
curls.
the rubber band exercises, a stretchy band is a really important implement exercise-wise that most people don't think about or have.
And it's so simple.
So simple. You can
So inexpensive.
So cheap. You can get it on Amazon or something like that, and basically go online. And nowadays you can find just about anything you want to know about with physical therapy. But it is a way to exercise the shoulder that's relatively safe if you're afraid of weights. It takes a couple minutes. You can do it in your home. And I tell people, if you had to pick one thing for prevention of shoulder troubles, it's a rubber band exercise program.
And you said a key thing here. You said going online. Online is not a doctor.
That's right.
They're going to give you some advice, but the worst thing you can do is say, I did it because I saw it here.
That's right.
And the next thing you know, they're giving you a serious visit.
That's right. And having an appropriate physical examination and x-rays is really important in the shoulder. I tell you, the shoulder is one of the last areas in the body where it takes the whole skill set of the doctor. You have to have the history, the physical, and really the imaging as well to make a good diagnosis. Some people think they have a rotator cuff tear and they have arthritis of the ball and socket joint. Some people have a frozen shoulder, as I was mentioning, and they think they have a rotator cuff. And the treatment is different. It really is. And you don't want to spend a lot of money and time waiting to get better with this one diagnosis in mind that you've made for yourself and not really be on the right track. So it's important.
Good. We're going to let our viewers know that Dr. Murphy's with Houston Clinic.
Yes, sir.
You have 2 locations here in Montgomery.
That's right.
That are within this coverage area. Do you have one in Auburn?
Auburn and Wetumpka as well.
And Wetumpka. So you've got 4 in our coverage area
That's
here.
right.
And can they just call and make an appointment? They don't have to be referred by their primary care physician.
Yes, sir. It depends on your insurance, and there's certain insurances that require for referral, but vast majority, especially Medicare, usually not a problem. And just give us a ring, and our front office will make sure that you know whether or not you need a referral or not.
Good. Thank you so much. And just
Yes, sir.
remember, when it starts, nip it in the bud. We'll be right back right after this.